There are
One more slide. Yeah. Next.
this is a MDT slide. You're able to see?
Yes.
Yeah.
Hi, my name is Dr. Fatma in the gynae clinic today. Can I confirm your name and age, please?
Yeah, I'm Mrs. Caroline Mitchell. I'm 54-year-old.
And how do I address you?
You can call me Carolyn.
Carolyn. Hi, Carolyn. How have you been doing?
Yeah, I had been fine, doctor. No current concerns as of now.
Okay. So you are here to discuss your investigations report. Am I right?
That is right. They told me that the doctors decided on something, and further plans they would be discussing with me today.
Do you have any idea about the result, Carolyn?
Yeah, I know I have cancer from my ovaries, possibly, they told. And they arranged certain investigations. I believe they are with you. And I'm here to discuss the further plans.
I'm so sorry, Carolyn. I'm meeting you in such a difficult time today. I know it's not easy. It must be a shock for you to know this. How are you coping with this?
Thanks for asking, doctor. Indeed, it has come as a shock. At initial times, I couldn't believe because I live with my husband and I have two beautiful daughters and I have a very active working lifestyle. But this came as a shock. But the counselors had been very helpful. So yes, thank you.
I'm so sorry, Carolyn. I know it must be really a difficult time for you. I'm glad you are connected to counselors. I will also connect you to support groups. Okay, and as a team, we are there to help you, Carolyn. You're not alone in this journey. Okay. Carolyn, can I ask you a few questions because I'm meeting you for the first time? Then we would come to the discussion of your investigation and also what the group of specialist doctors who are going to take care of you beyond this, they have decided. Is that okay?
That's all right. Yes.
Okay, Carolyn, can you tell me what, what were your symptoms and how did it all start?
Yeah, it started 3 months back. I started losing weight and I couldn't take much food. And my pants were really tight at the tummy level. And I went to the GP. He ordered some tests, and the initial tests, from those test results, they told me that there's a high possibility this could be a cancer. So here I am.
Okay, so there is. I'm so sorry to hear this, Carolyn. But do you have any loss of weight, appetite?
Yeah, I lost a considerable amount of weight, 4 kg to be exact.
Okay. And you were not being able to take food also, you said,
Yeah,
right?
that is right.
And are you opening your bowels normally?
Yeah, no concerns right now.
Okay. And your waterworks is normal?
No concerns, doctor.
Okay. And also, you told me that you have okay. You have two daughters. Normal, they were of normal delivery.
Yeah, they were vaginal deliveries. Yes.
Okay. And are you using? Have you gone through the changes, the hormonal changes that
You mean
you?
menopause? Yes, I
Yes.
did.
Okay. And have you been taking any medications?
No.
For
You mean
anything
for menopause? No.
no. Okay. And your cervical smears are normal?
Yeah.
Okay. And are you having any other medical problem that you're seeing your GP for?
Yeah, I have high blood pressure and I have high cholesterol, both of for which I'm taking medications. They're well under control.
Okay, glad to know that. And are you allergic to any medication? Hi, ma'am.
No, no,
Hello.
no,
Okay. Have you had any surgeries in the past?
no.
Okay. And Carolyn, I also see that your sister has been diagnosed with this cancer. I'm so sorry to know about that. How is she coping?
She's doing well now.
Okay. And I'm glad to know that. And the genetic testing also has not been done on her, right?
No, not that I know
Yeah.
of.
Okay. So, any other cancer of the bowel or of the
No,
ovary, of the womb or anything else in the family?
no,
No history of clots?
no,
Okay. And how do you smoke, Kathleen?
no.
Okay. Take alcohol? Okay. And are you well? You feel well supported at home? Who is there to support you?
I have my partner. He supports me quite good.
Okay. So you feel safe at home, right?
Yes, I do.
Yeah. Okay. And we can have your partner also come when we are discussing the result. Okay.
Yeah, that's all right, doctor.
Okay. And I know that you're going through a lot. We have, as I told you, you're already connected to counselors, so it's good. Okay. And do you know your height to weight ratio? Okay. Okay. Oh, and Kelly, coming to your results, um, can I have them? We have done the CT scan, and I have some. I see that you have come alone. Is your partner that willing to come, or someone, or you want from my nurse
That's all
side?
right, doctor. You can tell me.
Because I have some serious
I know.
concern.
I know. The thing is, I know it is cancer. Has it spread?
Yeah, that's I want to I want to be very honest with you with the results that it has spread, and it has spread beyond the womb, and it has gone to the omentum, that is
Mhm.
the lining of the which covers our organs.
You mean it has spread to my body? Oh my God. What does it mean?
I'm sorry to say all this. I know it is too much information, but yes, they have staged it as a stage 3, which means that it has gone beyond Caroline, beyond the womb and the ovaries, and it has gone to the which we call as the omentum, which is a
Mhm.
fatty layer which covers these things, and it has gone there also and form cakes over there.
I don't get it. What does it mean to me, doctor?
Yes, I know that. I will be explaining that,
Mhm.
because of staging, our you will be under our group of doctors, and they have already seen your results, and they have come with the management plan. You are,
Mhm.
let me tell you that you're in safe hands, and we will be taking good care of you. Okay. And
Okay.
from now, we will be the group of doctors, they have decided that they would want to do the surgery, where they would
Mhm.
want to remove all the place where they feel that the cancer has spread first, before they start any other chemo or radiotherapy, that is giving medications for the cancer to kill the cancer cells. So first they want to undergo the surgery, and then they want to do the further treatment. Am I clear to you, Caroline?
Yeah, doctor. So, what are my chances of cure?
Yes, Colleen, with today's advance in treatment, the prognosis has, that means the chances of survival has improved. But I will also the MDT will be the right people to tell you. Around 60%, means 6 out of 100, 60 out of 100 people, they have a good survival rate after the chemo and today's chemo and the radiotherapy. Okay, and after the surgery, we will also
Okay.
have to connect to
So,
genetic counselors.
do I need chemo?
Uh, yeah, you will have both. They will decide whether they will have, yes, they will have to give you chemo
Mhm.
and chemotherapy for sure. But they are the ones who will decide. Okay. We will
Okay,
also
got it.
connect you. We will also connect you to the genetic counselors, because this is also we have to know the genetic constitution of this, and
Mhm.
we have to check on your daughters, and also we will ask your sister also to go through the genetic counselor. Okay.
Mhm.
Am I
Okay.
clear?
Yeah, doctor, I have one more doubt. See, my sister underwent she told me that hot chemotherapy. Will it improve my chances? Because 60 out of 100, it doesn't sound so good to me.
Uh, hot chemotherapy, have you heard of that? What it is?
Yeah, my sister underwent that. I believe she had a difficult time, but right now she's doing well. Will that improve my chances of survival?
Hot thermography, let me explain it to you, Caroline. That is,
Mm-hmm.
we are injecting the chemotherapy medication into the abdomen, into the
Mm-hmm.
tummy, so that it
Mm-hmm.
kills all cancer cells which are around, which we are missing. Okay. And also the side effects are less with that. But survival rate, I want to ask my oncology team, and they will be the ones who will be telling you about the how it would improve your survival with that. Okay.
Mm-hmm.
But
Okay.
I from what I know, that is the side effects will be much less than when we inject these cancer killing medicines into you, which normally you will have, nausea, vomiting,
Okay.
mouth ulcers,
Okay.
hair loss. So these
That's
are
all right.
things which,
Okay.
yeah.
Uh-huh. So
Okay.
what now? What further, doctor? You told me I have to undergo the surgery. What further?
Yeah, so I will, we will, I will give you all the information about this, and I will document whatever we have said. And then we can start, you can talk to your partner and your relatives at home, and we will connect you to genetic counselor, so that, we start from there. He will brief you on all the genetic possibilities with your daughter and your sister. And we will also start now making the arrangements for the surgery with our oncology team, and Yeah, and you will be. I mean, I forgot the MDT, ma'am. That you will be under the group of the special doctors, Macmillan doctors, nurse, and the oncology doctors, the cancer doctors, and my consultant, and the gynae oncology consultant. They all will be taking care of you, and the special nurse. Are you with me?
Yeah.
I'm
That
so
sounds good.
sorry. I was really sorry, and but you're not alone in this journey. Okay,
Thank you, doctor. That sounds reassuring. Thank you very much.
thank you.
Okay. Well done. Dr. Fatima, your reflection, please.
I went beyond time, and I forgot. There's so much to tell them in this, and you have to be so empathetic. And you,
You
when you
understand
start
that
the
gravity
station,
that
yeah,
is
when
with
you start the station, ma'am, all the points are there. But when you are into the thing, it drives you off, and then you miss on so many things.
that happens in the initial phase. It gets better with practice. But you understand the gravity, that is a good start.
Yeah.
Sumi, shall I go with my feedback?
Yeah. Yes, Meera.
Okay. So overall, it was a fair presentation. As a lay examiner, I should say that overall it was fine. I felt reassured. My emotional question was addressed, and she was very reassuring. At the same time, she was honest about her information that she was giving me. And to start with for the information gathering, there are certain things you need to assess. Whatever is my understanding so far, that you got it right. The other information gathering point is the emotional question. This you addressed it right and you repeated it. One problem that can happen with repetition is you will run out of time. So kindly avoid the repetition. Once or twice address this empathy, and do not go beyond whatever is necessary. Do not talk about counselors more than once. So initially, if you are touching it, that's fine. Do not repeat it. That should be enough. In your overall body language, in your overall tone of the voice, that should tell the examiner that you are empathetic. And the moment you started the station, your tone was very enthusiastic. And then you grouped yourself and then you came down to mirror my voice. So make sure your demeanor is also in a neutral tone or in an empathetic tone to start with. So that is what I felt initially. And the other information gathering point is my personal concerns about my daughters, my sister, and whether the genetic testing has to be done or not. Even without my prompting you, you went on to that. So that is a good thing. Okay. And you set an agenda that was clear, and that you set an agenda after understanding my concerns. So information gathering from a lay examiner point of view, it's well established. So communication, you did not use much jargons. You did not overemphasize on whatever is the stance of the MDT. Apart from whatever is given there, you were honest about it. Empathy wise, you scored well. You can turn it down a little bit, because I know to start with, we will be going on too much about empathy. For some people, it will be very less, very little. But since you are a clinician who understands the gravity of a cancer patient, how she is going to be, how she is going to undergo all these things, you're able to understand. So you are overdoing it. So turn it down a notch so that it is just up to the mark. And regarding the whatever is discussed in the MDT. So what exactly you're trying to say, the discussion needs to be a little bit clear. Like, for example, you are here to discuss the further steps the MDT has discussed about you, and they have come up with a care plan I'm about to share with you. So this constitutes what we call a primary cytoreductive surgery. This is a major surgery involving this. This clarity was a little bit missing, but you mentioned it all right. You mentioned it, but it needs to be a little bit clear. So signpost whatever you're going to say. This was done. This was decided, which is what is proposed. Are you with me so far? Do you have any doubts here? And then go to the next chunk. So that will be a better way of giving this information. So it's about, for the communication domain, it's about a shared decision making, whether I'm willing to go ahead with this process at all. So at the end, you are about to get my whether I am willing to proceed, and I'll be documenting our discussions. That is coming to a mutually shared decision, documentation, and a shared decision making. So that you addressed well. And my questions, I had certain questions. We did not have time. Some of my questions you were able to understand and mention it even before I asked. Like, for example, my daughters and has it spread? So those questions you addressed it well. So there at that point, while you are discussing about the stage of the disease, it felt a little bit dragged. For example, this is what we call the stage 3. It has spread to the lining layer of the tummy. This is what we call stage 3. When I asked, has it spread? You told, yeah. Yeah,
Yeah.
that's great. Kindly avoid that. Yes, sir. Do not give yes or no answers. I do understand your concern. Generally, if it is confined to the ovaries, it is stage 1. And then so don't go to the womb. This is not a womb cancer. So an applied knowledge might be going down there. So make sure you are, well grouped to the actual cancer, whatever it is. So that is one thing. And so shared decision making, you are able to answer well. For the patient safety, what was my clear next step? That was not clear. So what will I do now? That I had to ask you. What does it mean now? Because you were carried away with my questions. Do not overstate certain explanations. Try to bring it down so that your overall time is there. So do not repeat things. Okay. So for a patient safety, whatever is my next step, and whoever is going to be a named contact for me, the CNS will be in touch with you, arranging the next steps. It will be done on as soon as possible, right? So that needs to be done, and safety netting needs to be done, and genetic testing, which you mentioned. So that is from my point of view. And don't overemphasize on the safe hands and all that. Just mention who are all the group of doctors. They are specialists in dealing, and just name them. And the safe hands doesn't have a big deal there. So that's about it. Overall, it was a well done station, Dr. Fatima. Thank you.
Sorry, ma'am.
Yeah.
Who's the nurse who's going to be going to tell you about the next step? CNN.
Yeah, CNS, clinical nurse specialist. Yes, she'll be the like a coordinator. Yeah. Over to Sumi.
Yeah. So, Dr. Fatima, I go with Meera. Yes, it was a well-done station from the communication point of view. Just a few points you need to add here and there, and some amount of refining, and proper, a little more structure, being more, you need to have more idea, like you need to be clear about what you're talking about. Otherwise, it's a well-done station from the empathy point of view, your communication, the way you had addressed her concerns, you validated her emotions, it was all very good. And the one important thing I wanted to tell is the timing that you're taking. You are taking a lot of time for information gathering. See, before you had come to information gathering, just the introduction, you took 2.5 minutes, and then the information gathering went on for 4 minutes. See, this is the reason, because you need to communicate a lot. In these kind of stations, so most of the history findings are given to you in the task instructions itself, so that you do not waste time with information gathering and you go on into the communication part, because there's a lot to discuss with the patient. So here, while starting, it was very good the way you started, how you validated her emotions, then you reassured her. It was all very good. Then the role play will feel like I've been supported, I've been heard. The role play will feel comfortable as well. So that has also gone well. And so now when you go into the thing is, you repeated the same things again and again. That is why the introduction, the starting point took around 2.5 minutes. Okay, with proper practice, you will be able to, cut short this introduction, that is the starting point. And then now coming on to the information gathering. See, already the instructions are given. She had bloating, appetite, loss of appetite, weight loss. You can just tell that you had these kind of symptoms. You can start that way, and whatever is not there, you can ask her, how is your bowel and bladder works? In that way, you can cut short on your information gathering. And then even the medical conditions, hypertension is given. So you can ask any medications. I can see you have increased blood pressure. What are the medications you're on? You can ask that way to reduce your time. And then you asked about her daughters, whether it was a vaginal delivery.
Yeah, that was
not at all relevant. I know you wanted to ask whether there was any cesarean section to rule out any surgeries. That you can directly ask any surgeries. That's it. That will get, you will be able to finish it off. Vaginal delivery has no relevance here, isn't it?
No, I actually wanted to ask mode of delivery. So I went to vaginal delivery.
Yeah. So yeah, the practice will be able to do it. Okay. Then menopause on HRT, I thought, see, you didn't miss that. That was a very good point. Then smears was very well done. Allergies, medications, and related to, again, the genetic history, her sister history, all this, you asked well. And you also covered the history of clots. And see, again, smoking, alcohol, all this is given. So you can just ask, I can see you have alcohol occasionally, isn't it? That's it, just leave it. Okay. Just, you are, just confirm player. And again here, support, all this you can finish off in the beginning itself when she's telling you the history and all. At that time itself, you had asked her about her health concerns, then you also provided her with counselors. There itself, you can finish off about your support. Then she'll be like, okay, my...
then again, mental health. Okay, ma'am.
So you won't waste time. If you do all this, you can save almost 2 minutes of your time. And you have also said, like, once she said her husband is supportive, you told, like, okay, then you are safe at home, isn't it? See, again, this is not necessary. Why are you telling? Understand? Okay. And again, BMI, you repeated it. So I can see your weight to height ratio, your BMI is 29. That's it. They're like, yeah, okay, that's it. Just finish it off there. And then you provided her support before going with the results. That's fine. See, another important thing you missed is you did not tell her that I confirmed it with your name and NHS number.
Ma'am,
Yes.
I didn't say that. Hmm.
I don't think I remember. I heard that. If you have said, then it's okay.
Oh, no, that CT scan only. Actually, ma'am, I didn't see the blood investigations here, but CT scan, I read that on one of the things that, but I didn't tell about that confirmation, which is important. Yeah.
Whether you read it or not, that will be able to the examiner only if you tell. Okay. So always make sure whenever you talk about reports, tell about the name and NHS number.
Mm.
And then see, you should also tell the positive findings and also the negative findings. You had missed the investigations part.
Yeah.
You should tell that A125, that is one of the markers is
Not the
elevated.
marker. Yeah, that I didn't see. Okay.
The
ma'am.
other, yes. So the other two is normal, which means that there is it rules out cancer of the bowel or cancers of the bowel, and also some other blood tests have shown that they are normal. Okay.
Okay.
Then you go on to the CT. See, how you have to explain is you should start like this seems to be a stage 3 where the cancer seems to have spread from the ovaries into the lining of
the womb. Yeah. Lining of the tummy.
Yeah, fatty tissue inside the tummy. Okay. And however, it has not spread to other organs such as the liver and the spleen. Okay.
Yeah.
And also, at this point, you should tell that the final stage, the final diagnosis comes only after the surgery, after the tissue testing under the microscope has been done. Okay.
Okay.
And still here also, cancer will also be confirmed only at that point. You understand? Here we do not have a tissue report to tell that this is definitely cancer. You understand that?
Yeah.
Yeah. So that is it. So you're telling which stage it is and also what is the reassuring part of it for both the investigation and the CT report. And now you go on to the explanation of the MDT, that is the team of doctors. What have they told? So here again, you should tell that they have suggested for what is called a surgery followed by chemotherapy. And then you will be explaining about what the surgery involves. It will involve removal of the womb tubes and the ovaries and also the fatty tissue around. And if there is any other visible cancer tissue, will also be removed. Following that, we will be planning for a chemotherapy. At that time, sometimes the role player will be asking how many sessions, how long, and all they'll be asking. So according to that, you should explain that also. And they'll be talking about the side effects as well. So side effects, they'll be mostly concerned about vomiting. So vomiting, you can tell we'll be giving you anti-sickness medications. And for the hair fall, certain chemotherapy drugs may lead to hair fall. However, it is just temporary. It will be regained once the chemotherapy has stopped. However, further details will be given by the MDT. So this is related to the chemotherapy. And another thing, these are all applied clinical knowledge part. And one more thing I want to tell you is you told about 60 and 100 have a good survival rate. Better not to tell any numbers because here the staging is not confirmed. This will come only after the surgery. And also better the MDT will give you a clear picture related to that.
Okay.
Yeah.
Even for the
Yeah.
Ma'am asked about the
Survival chances.
injecting the chemotherapy into the.
I'm coming to that.
Okay.
And one more thing which you told well was due to advances in medical care, the survival has improved. However, I'm not the right person to tell. You told the MDT will be able to tell you better. This was very well done. Okay. But don't use the words like MDT. You tell the team of doctors. Okay, now the next thing what we're talking about is the genetic counselors. So when there is a strong family history, it is better to put in touch with the gynecological oncology team who will be doing the genetic testing. It does not need to go through the genetic counselors and then into the oncology and then going for the genetic testing. Okay. And now let's come on to HIPEC. So generally, HIPEC is advised only when there is this interval debulking surgery. That is, we have this neoadjuvant chemotherapy, and then you go on for the surgery, and then you go on for the chemotherapy. Only in such instances, you should go for the. It is generally advised to go for HIPEC. So if the patient is asking that, you can add a point like it's generally advised when there is a interval debulking surgery. That is after a chemotherapy. However, the MDT will be the better person to decide about that.
Yeah, exactly. I just wanted to mention one more point here, Dr. Sumi, if that's all right. So for the HIPEC, you need to be mentioning that because her performance status is all right and it is stage 3 and MDT has decided that PDS, the primary debulking surgery, can be done. Okay, so that is a better stance. That is reassuring. So she might not be needing HIPEC. Further on, she will be needing chemotherapy, as they have mentioned that they might need. Right, the mention was there in that paper. So so for cancers like yours, the evidence does not support the use of the HIPEC. Okay, this is whatever evidence we have is for the interval cytoreductive surgery where it has shown to be of benefit. So the risk benefit ratio is what you need to tell here. So there are risks also associated with HIPEC, like kidney damage. Okay, and so generally it is not offered for this cancers, but we will discuss this with the MDT and they'll be the better persons to deal with this. So this is the way in which you deal with that.
Okay. Actually, everything is there, but the 2 minutes we have to really see what every point is there in this adjuvant platinum-based chemotherapies. Everything is there. What the MDT wants to do.
That is true. That is
Yes,
true.
that is the reason we have to put it up. We need to practice how to take the important points from these instructions.
2 minutes, yes.
So
You should not be
so that is the
writing
reason.
anything down at that point. You should be quickly perusing it, quickly scan. Okay.
Now, if you're going to write, then we'll forget also, no, ma'am, what.
No, you should not be writing. You just take it in your mind and you deal with it. And these papers, you will also see this inside the cubicle. So you need not write everything down. If you have a doubt, let me go through your notes again. Just mention it and take that paper.
Okay. Okay, ma'am. Okay. Thank you so much.
Yeah, so let's go through the key then. Yeah. So domain-wise, when we go for information gathering, we need to establish her prior knowledge and then elicit her main worries, that is her concerns, and then address all of them. Then you're asking about the family history details, so that is her sister's age at diagnosis, what was the histology, any other relatives were affected, any other ovarian or bowel cancers, and any genetic testing has been done, needs to be asked. Then this is also important to make sure that she has this surgical fitness before going for the surgery. This point has to be, this was evaluated in the information gathering. We also need to mention a point during the discussion, okay? And so we should always make sure you avoid this spikes protocol, because the patient already knows that there is a suspicion of cancer, and she's just here to discuss the investigations and the MDT meeting. And going on to the communication with the patients and family, here again, always be honest, use jargon-free language, and keep answering her concerns there and then whenever possible, and validate the family history, because she's anxious about her daughters also being affected. And always make sure you do not give any false reassurance, and never promise that she will or she will not have any chemotherapy. Do not promise anything related to the surgery as well. Applied clinical knowledge. Yeah, so since the investigations needs to be explicitly discussed, and again, this the staging is only radiological, only the tissue diagnosis is the final diagnosis. Then addressing her HIPEC question, okay, that is her HIPEC concerns. And again, going into the the genetic testing related to the BRCA mutations, and that only 10 to 15% of ovarian cancers, that is non-mucinous epithelial ovarian cancers, they are inherited. So even this has to be mentioned. A few of the non-ovarian cancers are inherited. That point should also be mentioned. So again, avoid telling that radiological and surgical staging are both the same. We should never say that. And again, do not give anything like a yes or no kind of an answer. Then going on to the patient safety aspects, during the discussions, we should highlight on the point that there is a high VT risk related to both the risk of cancer and also the increased BMI, and surgery, the duration of the surgery would be increased. So there is a high VT risk. We will be assessing, and if needed, we'll be giving the prophylaxis. And consent related to the disease. If after opening there is any chance that the disease has spread, then the surgical plan may also need to be changed. And again, for the symptom progression, safety netting before the surgery, that is before when she goes to the surgery, you should always give her the red flags and give her the contact number where she needs to contact. Very important to give the cancer nurse specialist contact details, PIL. And always this hypertension, you should make sure that it is well controlled and medicines are being taken until the perioperative period. And now we'll go on to the station, that is how to go about this station. See, most important thing that you should know that this is not a first disclosure. She already knows that this is a suspicion of cancer. So you should give her what information she needs to know, and then the plan of the surgery, and you should address her specific concerns and fears. Okay, this is the main crux of the station. So the first 1 minute, you should finish off like addressing her concerns, her anxiety, and then giving her a reassurance. Then within the next 2 minutes, you should finish the that is, you should finish explaining about the investigation findings, what the blood investigations, what is the CT findings, and and about the definitive diagnosis only after surgery and histology. And in the next 2 minutes, you should talk about the MDT recommendation. What are they recommending? That is the primary cytoreductive surgery, and why the surgery is being offered before chemotherapy. The next 3 minutes you should have for addressing her concerns, because now she has this concern about HIPEC and about the chemotherapy side effects and about the family history, the BRCA testing, and about her daughters. For all this, you need a lot of time, because you need to address her concerns and fears. Then once you are done with this, you need to come to a shared decision making. Then how to proceed, what are the next steps of the pre-op workup, the genetics discussion, and then the follow-up with the consultant, the onco specialist. And yeah. And then at the end, you should close with giving her the red flags, written information letter, and then the nurse specialist contact, safety netting, that is the red flags. And if there are any other questions, you can ask her. Yes? Any other doubts you have?
Okay, ma'am. Thank you.
Overall, if you see the station, not much in terms of knowledge, or not much in terms of whatever we are going to do in the station. It's just the interim time, how you are dealing with the patient who needs to be relayed this further information. What are all the next steps? Briefly noting down the details, her concerns, and addressing the concerns, and then briefly mentioning whatever next steps she needs to go on with. So this will seem very frugal, but how you go about in those 10 minutes may matters. And information gathering is not just eliciting all the information. Make sure you get the info, whatever is in the candidate instructions. Whatever information is not there, you please elicit them, because once it is already mentioned, you're not going to be given any marks for eliciting those information again. Further concerns eliciting, whatever is her main problem, whatever is in her mind. So that is what is going to be marked under information gathering, where all informations are already given to you. So do not elicit the information which is already given to you in the candidate instructions. Just acknowledge and move on. I can see your hypertension. Is it under control? That will be the next question, that you are actually gathering the information. If it's mentioned to be under control, you will just note it down. You will say that I can see that your hypertension is well under control. Please continue your medications. So that would be how you give the proper care. You need not ask from the beginning, are you hypertensive? Okay.
Okay, ma'am.